Hello class, my name is Crystal Garcia and I'd like to talk to you about a fairly common immune response that affects our daily lives. Whether we are directly affected by anaphylaxis or a loved one is susceptible to it, we all should understand the severity of allergic reactions that can potentially be fatal. Although many of us suffer from allergies to some degree, especially during the springtime, we should be aware of how to take precautionary measures prior to this response. What is anaphylaxis? Anaphylaxis is a severe, potentially life-threatening allergic response to allergens that produce a chemical and physiological response in the body. In serious cases, a person may suffer anaphylactic shock and can potentially be fatal if not treated immediately. It is important to understand that there are certain precautionary measures that each person should take when aware of allergic reactions to certain triggers. When the immune system develops an allergen-fighting antibody called immunoglobulin E, or represented as IgE, results in an exaggerated reaction to an unusually harmless trigger, like food or pollen. Although your body may not initially react to the first exposure to a substance, it may produce antibodies that can potentially bind with the substance, causing mast cells to release histamine, the initiator of anaphylactic symptoms that I will discuss later in the presentation. This diagram explains the chemical response of anaphylaxis. In an anaphylactic reaction, the antigen triggers the production of immunoglobulin E antibodies. They bind to the receptors on the surface of a mast cell or basophil. Another exposure to the same antigen connects the two antibody molecules, causing degranulation of the cell. This then releases histamine and other mediators. Histamine then increases the permeability and distension of blood capillaries, causing a reaction.
Histamine then increases the permeability and distension of blood capillaries, causing a reaction.
Here are some of the most common allergens that cause the allergies your body reacts to. Some may be allergic to foods, molds, poisons, certain materials, animals, and medications. Anaphylaxis is diagnosed based on developing the symptoms. Some of the symptoms are medically known as chemosis, swelling of conjunctiva, rhinorrhea, runny nose, lip edema, swollen lips, arrhythmia, irregular heartbeat, hypotension, low blood pressure, urticaria, hives, pruritus, severe itching, and dermatitis, inflammation of the skin. In addition to these symptoms, angioedema similar to hives under the surface of the skin, diarrhea, tussis, coughing, dyspnea, shortness of breath, sibilant bronchi, wheezing, emesis, vomiting, cephalalgia, headache, urinary incontinence, loss of bladder control, and dysphagia, difficulty in swallowing, are also present. About 80 to 90% of the cases are skin responses. 70% are respiratory reactions, 30 to 45% are gastrointestinal reactions, 10 to 45% are cardiovascular reactions, and 10 to 15% are central nervous system responses. Allergic reactions can range from severe to minor. Medications are also a common cause of anaphylaxis. However, pollens and other inhaled allergens rarely are the main cause of anaphylaxis. Some reactions are manageable via over-the-counter medicines like Benadryl, an antihistamine and allergy medicine. However, anaphylactic reactions may need an EpiPen, an injection containing epinephrine that narrows the blood vessels and opens the airways in the lungs. This injection must be applied in the outer thigh to be effective. It is important to be prepared when you know that you are severely allergic to a certain allergen. So what can you do to avoid potentially harmful reaction to a substance? Skin testing is the safest and most effective way to confirm your allergies and the severity of your responses to certain triggers. These skin tests use extracts of common allergens like pollen, mold, dust mites, animal dander, and foods that could trigger a rash as the response. The scratch test or prick test applies droplets of the potential allergen on each designated area on the arm or the back. The stratum corneum of the epidermis is pricked to allow the skin to react. The response to each allergen indicates the severity of the reaction. The intradermal test consists of cleansing the skin and injecting a small amount of allergen under your skin. The patch test consists of a patch that the doctor sticks on the arm or back consisting of multiple allergens to be tested all at once. This usually takes about an hour to complete. Closed captioning and thanks to the following resources: medical terminology for healthcare professionals, WebMD, Mayo Clinic, and images from various websites on the internet.